I want them to grow. So how will they grow with this activity? And I think that's the most important thing, is learning how to discern the value of the activity. Not only will they be engaged, but how are they going to grow and learn and apply it differently to meet the goals of the lesson?
What if your students were more engaged, more curious, and actually excited to learn? Today, we're talking to two nurse educators who know exactly how to make that happen. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Picture this. It's week 3 of the semester, and you've prepped a brilliant lecture, but your students are glazed over and barely taking notes. Now imagine instead students buzzing in small groups, mapping out concepts, debating case studies, and actually asking questions you didn't even expect. That's the power of active learning. And today, we're diving into how to make that your classroom reality. I'm thrilled to be joined by two powerhouse nurse leaders who've helped shape the future of nursing education, from concept maps to case studies and the sometimes tricky terrain of the flipped classroom. We're exploring what really works, what to avoid, and how to keep students engaged and learning deeply. So grab your beverage of choice, your curiosity, and let's spark some inspiration. Dr. Virginia Ginny Wangerin brings over 40 years of extensive experience in nursing education and curriculum reform, while Dr. Sue Hendricks is a dynamic leader and nurse educator who is known for creating impactful, student-centered learning experiences. Welcome, Ginny and Sue.
Thank you.
Thanks so much, Kelly.
Yeah, you're welcome. So excited to talk to you today. Let's start with the foundation. What advice would you give to faculty who are just beginning to explore active learning strategies? What might these strategies be? How would you use them in the classroom or lab or clinical? And what are the key benefits for students?
Well, so Kelly, I've worked with a lot of people who have become faculty after being expert nurses. And nothing sparks fear in their hearts more than having to do something besides lecture, because they know their material, but they have not experienced a whole lot of really good active learning. And so there's some trepidation about how things will go. I guess I would say my best feedback would be start simply and grow yourself. When you begin, feel like you have to make your entire lecture time active learning. You may get there in time, but you have to be comfortable doing what you do as an educator. And so I would say start with some simple active learning strategies. And I would also encourage you to keep some kind of a log. I don't know how many times as an educator I have gone to really good conferences, and I'll be sitting in the audience and I'll think, that is the greatest strategy ever. And I'll get home and it's gone completely out the window, right? And so I actually have it in a Word document. I just have a list of all the ideas that I have come across over time. And I'm sure I've missed a few, but it will start to build sort of a library of things that you can use, because your students they'll enjoy at least some variety. So I would say that would be really important. Ginny, what would you add?
I think that's a great start. And in fact, I have to laugh because here we are. We've both been doing this for so many years, and I have that kind of a list. I have it on my computer, and when I come back from something, I journal these ideas. And I just recently went back to look at them again, because I'm like, I want to do something a little bit different when we present next together, right? Because we love to team up and do fun things. So the other thing I would add, though, is that like any other, new skill or developing a new expertise, cooking or gardening or whatever it is, you turn to people who are doing it well. You turn to those people who you see something you like. And I think that it really is important that those of us who are seasoned really nurture those who are younger in the nursing education world, and that they have the comfort to come to us and try something. And the other thing is, let's always be gracious about it doesn't always work. Even if it worked for Sue, it may not work as well for me. And that's
Exactly.
okay. And it demonstrates. In fact, I think when you can eat a little humble pie with your students, it helps them to realize it's okay to not be perfect one day, but learn from it and do it a little bit better and give feedback, and everybody grows. So yeah, approaching it from that, I just want to do this and I'm going to use whatever resources I can find and I'm going to take some risk and it'll be okay.
Yes. Yeah, I tend to be comfortable being pretty far out there and doing some wacky things. I've been known to stand on desks and do all sorts of things. Not so often anymore, but I'm still pretty comfortable with it. And I know that's not everybody's gig, right? Not everyone is going to want to do that. But the beauty of this is that there are so many different ways you can engage students and get your room hopping and buzzing. I think the biggest thing that I would say as you get started is do not assume that you can do this well without planning. If you want a really good active learning lesson where students are really learning a lot, it may seem like it's coming right off the cuff, but most of the time it's not. You've really thought about what do you want students to learn and what are the questions you can ask and the scenarios you can show them and the ways you can stretch them into learning. It is not that simple as, oh, I'm just going to ask them to discuss this. That will fall flat.
And it's sometimes sharing your own stories and experiences that really bring that concept or that task to life. Sometimes students have that perception that their instructor, maybe they've never made a mistake. Well, we've all made mistakes. We've all floundered a little bit. And the first time I tried to take a cap off the syringe, I stuck the needle in my thumb and I had blood going all over the place. And they, oh, you did that? Yes. Let's not be that guy. Let's do
or spiked an IV bag without having it clipped off. Like,
oh. and the liquids all over. Yep, exactly. So how do you as educators balance creativity and with the structure when designing lesson plans? Just wondering how you might do that.
Well, I'll tell you what I do, and it's pretty simple because I can go a little off the rails. I put my lesson plan for the whole time period of the class in a PowerPoint. And I literally will have when it's time to do a learning activity, my next slide will be that learning activity. It might not be all of it, but it'll just be like, okay, this is what we're doing next. And I typically do intersperse some lecture and discussion with actual learning activities. And so it kind of keeps me on track so that I don't get halfway through my day and I'm supposed to be talking about psychosis and I've only gotten half the way there. What do you do, Jenny?
I very much like that. But what I do is I kind of have backups, right? So that I can also, and this comes with a little bit of experience, but so I can kind of gauge how things are going. And I feel like they're just getting sort of dull. I'll bring out something that's maybe a little more different, a little crazier, just to get them laughing. I love having some fun in class, and I want them to always leave having had at least a little bit of fun. I think when you get a little further down the road of your comfort level and having a variety of ways behind you, then you can do that. You can have those. But I start off with smaller doses and get a gauge at how the students are doing. And it also helps. You want them to have some comfort within their own group, right? You don't just do everything the first week of class before they know each other and they have some comfort. So you build that community. And then as you build it, you can use more variety and do more things.
What do you wish that more faculty understood about student engagement and learning design?
What I see is that we're starting to elevate the evidence base of learning to merge it with the evidence base of nursing, right? Of what we will do. And I want to see that continue because there is a difference between just having a noisy classroom and having an active learning classroom that's also noisy. So I think if I could give one piece of advice, it would be you always start with the desired outcome. What will they know when we're done with this activity? And it has to be meaningful. So no, I'm not going to spend a significant amount of time doing vocabulary cards if this is not the first day of the fundamentals class, right? Because that's pretty basic. I want them to grow. So how will they grow with this activity? And I think that's the most important thing is learning how to discern the value of the activity. Not only will they be engaged, but how are they going to grow and learn and apply it differently to meet the goals of the lesson? And it's not easy, but here's the deal. Doing a great lecture that also gets them there isn't easy either. And it's way less fun, both in planning and delivery. So I opt on the side of, I work hard to make fun, active learning classrooms that look like it's easy. And it's not, but I sure enjoy teaching more that way.
When you asked that question, in my mind, I thought, well, backwards design, of course.
Yes.
And that's exactly what you said, which kind of cracks me up. I also think that whether or not you are working from a lesson plan that has student learning outcomes in it, I'd say make a list of what do you want your students to get out of this and write it down, because you can spend a lot of time on some fun activity that doesn't really go to where you need the students to go in their thinking and their growth. But if you are mindful about what do you need them to get out of this, you will design things that get closer to that.
I was thinking about a quote that really gets at the heart of today's episode. And I came across from Benjamin Franklin, right? Tell me and I forget, teach me and I remember, involve me and I learn. So exactly what you two have been talking about. Get students involved, get them excited about the content, make it fun, which becomes more enjoyable for the instructor as well. So we kind of covered the basics. So let's explore some kind of powerful teaching tools. I've heard both of you in past advocating for combining like concept maps and compare and contrast techniques and case studies. So let's unpack those a little bit and those strategies and how they might work together to create meaningful learning. So I guess my question is, can you share how you've blended these in your own teaching? How have you used these engaging teaching strategies?
Kelly, you're talking to my recipe card, right? My favorite recipes. I love putting these together. And I often, when I'm working with more novice faculty, will say my top 3. These are them. And it's because I think because they are so versatile and they're also rich enough that students really have to dig into the material. So for instance, if I'm working early in teaching them about a concept, so we're just learning the basics about it, I'll probably start with some compare and contrast. So I might have them look at this concept across the lifespan. So if we're talking about growth and development, I might have them look at different ages and then talk about, across the lifespan. Or if we're looking at a concept like oxygenation, the assessments, the norms, the deviations, and kind of then talk about some of the things we might look for. So I might start with that. And then somewhere as we're unfolding this concept for the first time, we're going to learn about the typical drug classifications and typical medications they may encounter. So that's another great time to do a compare and contrast. All the classification, the pharmacodynamics you need, but then also add in some key assessments, patient teaching, administrative guidelines. It's great with the compare and contrast because they have to limit that information and pick out only what's important to put on that paper because I give them limited space, right? And so it makes them think it through and then it leads to a rich discussion. And then finally, I might move that into some case studies. Let's explore this through some case studies and then take one or more of those case studies and then build a concept map around it so that we can look at how they overlap and how they're different. Now, as we further along in the curriculum, I might do almost the opposite. I might start by giving them 2 or 3 case studies and having them overlap them, connect them, compare and contrast them, and create maybe a more complex concept map. We might even unfold it on the wall or on, poster paper or whatever. So the nice thing about those is that They have different kinds of interaction. You'll see different types of ways of looking at information. And so I can mix and match them in a variety of ways. So that's one of the reasons I really love them. And I love incorporating them into sim and especially into clinical. That's my favorite way to really get students engaged in clinical as well.
Absolutely. And especially when you're, working with complex content areas,
Exactly.
Yeah. So you just mentioned key assessments, right? So, how do you measure the effectiveness of these strategies, either in real time over the semester?
So I love all three of these strategies, but I don't think I may be as good as Jenny at putting them together. But I really like all the different compare contrast activities, and you can make this into a very simple formative assessment. So, for example, one of my favorite compare contrasts is the optimist pessimist game. So you have a short little case study. Maybe it's a patient with a head injury and they're admitted, and you set the stage. So then you pair people up, maybe, because I like working with students in pairs for short activities because it's efficient. And because if you're in a pair, you cannot scroll on your phone very well. If you're in a group of 5, you can scroll on your phone. Okay. So optimist, pessimist, give me a list of 5 outcomes for this patient that would be optimal. What are you hoping would happen? Right? What's the good outcome? And then pessimist, what's the worst things that can happen? Okay. And you can even use your learning management system and make it into a quick quizzy type question. If you want to really know and grade it, you could. I don't do that too often because I think when I'm in a live class with students, you can see them working on it. And then you start having a discussion and you know they're getting it. But if you feel like you need to verify it, you can pretty easily. You could even do it with paper and pencil, right? Kind of like a classroom assessment technique. Give them an index card. On one side of the index card, put 5 things that you would do in this situation. On the back of the index card, 5 things that you would not do with this patient. And those are all variations on compare contrast.
I love that.
If you need the data, you can get it, but you don't always need the data to be able to see that your students are learning. If you're in the room with them, you can tell.
Yeah, it's that light bulb moment, right?
Absolutely. I want to build on what Sue said because when I talk, especially to newer faculty, there's really 3 keys that I suggest that when you're building an active classroom that you adopt. And one is that I always walk around the room and I always have paper and pen and I jot down phrases and words that I hear so that I can call these out and kind of pull out from that discussion. And also, though, it lets students know that I value what they're doing. I'm listening, I'm paying attention. I can correct and I can reinforce. I can do a little bit of both. So that's an important part. And the other part is that, just pay attention to their engagement and call the question before everybody's done. Don't wait until everybody's done.
Don't wait until they're scrolling.
Exactly, because then you've lost them, right? So give a little less time than it takes to get done. And then finally, it's important with every activity that's taking a chunk of your time, right? It was significant enough that you did all these. Then do some debriefing. Okay, so what did you learn from this? Or what was the hardest part of this? I also really believe it's important as faculty that we debrief after we teach a class, and I still do that. Immediate. What went well? What would I change and how would I change it? And write it down now, because at the end of the semester, it's long gone. And so, yeah, those are the guidelines I really encourage faculty to incorporate into their own behavior. And then students will respond. Thank you.
So can I also say that when you're doing this, one skill set that is very helpful is learning how to really uplift students in their answers, but also make sure they have the accurate information. So you have to practice ways of helping them when a student blurts out something and it's really not right. You can't shut that student down, but you can't let the inaccurate information sit out there.
Exactly. Find ways to say it's a really interesting thought. And I kind of see where you're coming from, but let's refocus on this piece. Just guide them somewhere. Show them how to do that. And then you're showing them also how to use better communication with their peers and when they get into practice. So we need to demonstrate the professional comportment we want them to develop as well. So that's a great one, Sue. Thanks.
Let's flip the script a little bit, literally. So let's talk a little bit about flipped classrooms. It has definitely gained traction, but it's not without its challenges. So let's talk a little bit about how to make it work effectively, starting with that big picture. What is a flipped classroom? Maybe this is new to some nurse educators, this whole concept of flipped classroom. And what's the rationale behind this teaching strategy?
Go ahead and start, Ginny.
I will, because what's interesting is I first learned about a flipped classroom when my now 40 plus children were in grade school, and they introduced this. And really, I think we in higher education sometimes made mistakes in getting started. So I'll start with that, right? In the best flipped classroom, you're giving the students very targeted, reasonable, guided preparation to come to class with. And that includes components of what you would typically lecture. But what you do not do is take a 60-minute lecture and just record it and put it out there and say, listen to this. That doesn't work any better. In fact, it's worse if you just do that than if they just came to class and listened to you, right?
Because they're angry at you.
Yes, it's not fun. I wouldn't do it. Why would I expect them to? So give them this very targeted, focused information. Bring them to class. And in my world, I also believe in doing a bit of a readiness assessment, right? That comes out of team-based learning. Yeah. So we do a check-in, and then I can clarify, expand a little bit. I take 10, 15 minutes to just get the land laid so we're all in the same place. Then we apply it. We do that active learning, and it's going to be more effective because they came with just enough preparation to make it work for them, right? And they can still do some digging and working with each other and finding the answers. Then you leave enough time to do, again, that debriefing and that correction, as Sue mentioned, is so important to make sure, okay, and then summarize it for them. Okay, so this is what we covered today, and these were the key points, and what else do you want to add, or what muddy points do you still have? So done right, a flipped classroom is the best of all the best teaching, right? We plan it well, we have them prepped, we engage them, we assess how they did it, and we wrap it up with some kind of clean final things, and then it works well.
I think that's spot on. And you hit on one of the biggest downfalls that new faculty trip into when they're trying to apply it. And that is trying to front load the whole thing, all of the chapter on heart failure, right? Because it's too much time, and it's also very difficult sometimes, right? And so that preparation needs to be manageable chunks that are not that hard. If there's a concept, like especially a physiologic concept that's quite difficult, I might actually take some class time and explain it at the right moment, not lecturing the whole time, but I might do that. Don't be afraid to explain something. But I would add that the prep needs to really be thoughtful and focused. And the learning activity should also have enough complexity in it that you address all of the pieces that you really want to get out of the day. It can't be just, oh, we're going to have a little, sometimes learning activities are fun, but they're not that meaningful. So we really want to think about what we're going to be doing. I would also add, if all your colleagues in your school are lecturing, you're going to have a hard road to hoe to get people to like your flipped classroom. It is much more palatable for students once they've done it a few times. So if you and a number of your colleagues can all get together and begin to teach this way, you will see great results in your curriculum, and your students will get over that feeling like, I'm just teaching myself. And you know what? Here's the thing. The person who does the work gets the learning. So, yes, you are teaching yourself and you will be for the rest of your life. But let's make it fun.
Yep, making it fun. And I appreciate you both talking a little bit about those common pitfalls, because there is an assumption of faculty that using a flipped classroom strategy, it's easier than to prepare for a traditional lecture. And that's
No.
not necessarily the case, right? So, and as you said, being able to show students and have students really understand the value of that flipped learning, especially if they're resistant at first and no other faculty member in your program is using that type of strategy.
I think that's a place, Kelly, where having some transparent discussion with them about why you're doing it, like, why am I using this methodology, can go a fair way to helping them accept it.
And I also think one of the primary reasons that flipped classroom has not worked in some places, or where some students had a bad experience and then now they're reluctant to engage in it again, is that it's that mistake of planning it out front. We have to remember that our students, they have other courses, they have a life, and we can't ask them to do, 10 or 15 hours of work to come into a 3-hour class session and then follow that up with some more work. We have to be reasonable about it. And if they see that, okay, I am providing for you this foundation to make class time worthwhile. And once they see that, they don't want to go back to the other. And I taught an entire leadership class one time, never opening a PowerPoint ever. We did a lot of the things we talked about, right? The concept maps and the cases and so forth. And I had a student write in the evaluations. The first time I ever took a class without a PowerPoint, and it was great. It reminded me of how important that can be. And so I've really tried to keep that idea. I use them now, but I use them very differently. I use them as organizers. And as Sue, you pointed out, you kind of put what you want to do in the time, and your time frame, so you know that you're getting through your content in the time you want. But they're just organizers. Students have to pull out the information. We help them work with it. Then we collaborate to make sure they understand it. And then they're set up to continue learning.
Thank you so much for that. Those great pieces of advice too for new faculty and seasoned faculty. So as we wrap up this episode, this session, I'd love to hear from each of you. What's one spark or pearl of wisdom you hope listeners walk away with after hearing this episode?
Well, I'll start. Jenny, you opened this up by talking about recipes and them flopping. And so my spark is that learning to teach actively well is a lot like curating a really good dining experience. It takes planning. You have to think about what goes well together, what pairs well. And if you try to do everything in one meal, it will be overwhelming. The best meals have different courses, but they go together well. And similar to what Jenny said, it's okay to try something and have it not work. It's fine. It's going to be fine. In fact, if you can laugh at yourself in class and say, well, that's one for the books, I won't be doing that again, they'll laugh right with you, right? So you've got to have a little bit of humility.
And building maybe a little bit on what Sue said, that part about kind of getting creative in different recipes. I take a cart to class with me, and I have colored pencils and markers and all kinds of stuff and big paper in the classroom. And I really believe in bringing in some of those brain-based learning principles and having students manipulating things, being very multisensory. I try to be very multisensory in my learning activities, because we know that if we help our students become more adept at using all 5 senses and at really engaging their brain and their body in the learning process, just like we did when we were children and we played, right? If we can bring that back then the learning is more likely to stick and to come back. And I think too, when we do these, I talked about the debriefing, but let's not forget that when we come back the next class session, whether that's 2 days later or a week later, whatever it is, let's take a few minutes at some point to kind of reflect on, okay, remember from last week or the last session, thoughts since then, or did you think about that when you were in clinical this week? Help them to start building and scaffolding their own information as you do that. And so linking our activities from not just through the class session, but really throughout the course will help them to start to see that path to the end and where they want to be and to know that they've arrived. They can recognize what they've learned. And that's a joy for both the students and the faculty.
Thank you so much. What an energizing conversation. I appreciate both of you, sharing your stories and your expertise and practical strategies, your passion for teaching and your commitment to student success. They really, truly shine through. So thank you. And for our listeners, whether you're flipping your classroom or integrating concept maps or developing case-based lessons, remember this: learning can be fun, and the magic is in the methods. And these strategies aren't just about changing how we teach, they're about transforming how students learn and how they think and grow into confident, competent nurses. So thank you, ladies, for sparking new ideas and inspiring us to all try something different in our next class.
Thank you so much for the invite.
Thank you. Thank you very much.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.